Hi everybody, Ariana here at the AAFE Training Center. Today I'm going to kind of walk you through what a typical treatment looks like in the office with me and my patients. Luckily here I actually have one of my favorite patients because she's a coworker. So I'm kind of walking through why I treated, where I treated, why I'm using the products I'm using, and essentially just a full facial rejuvenation treatment in general. So prior to this video, we did ultrasound because I, as you can see, started in the piriform fossa, which is a higher risk area. We want to make sure that the arteries are where they are on average, which is going to be more superficial is what we would expect. So I like to just make sure that that is absolutely still the case on an ultrasound. So I do ultrasound the piriform fossa, I ultrasound chin, and I ultrasound temples prior to actually injecting them. So just wanted to throw that out there before you guys see me walking through this treatment that I did ultrasound as a safety tip. And we do teach ultrasound in level 3. We briefly touch on it in level 2, but we also have our own ultrasound course as well, which kind of walks you through how to understand an ultrasound, what to look for, where to expect the anatomy, everything like that. So we also talk about other techniques if the anatomy is not where you expect it to be as well. So keeping that in mind, I did start in the piriform fossa on this patient just because I had a sharp needle. It was not primed. It had nothing in it. So I was going to get an aspiration ideally if I did have a positive aspiration. Now, it's a little bit harder when the needle's blunt. It makes the patient more uncomfortable. It's not as good of an aspiration. And when there is product in that hub. So keep that in mind. Then I moved for this patient over to the cheek for her. And you can see I'm just kind of making my marks all over the place on the cheek. Just because I'm assessing her, I'm coming out and re-looking at the patient's face before I'm moving to the next location. So on her, I absolutely loved treating her because she was easy, right? She was the ideal candidate. It was so easy to find bone. It was so easy to kind of get where I wanted to go. And so also she's a friend and a coworker. So of course that made it a little bit easier too. But I did do one cheek and then I focused on the jawline as well. And then I like to move to the other side. The reason being, and this is just personal provider preference, I like to show the patient a side by side. I like to say like, hey, here is what it's going to look like on your jawline. We're going to, do the same thing on the other side. Of course, too. You can see I'm holding pressure. I gave her a little bruise and she's laughing because I told her, of course, the first poke, I give her a little baby bruise. So yeah, as you can see though, I am just working my way around. I just kind of held some pressure there. She also has a vibrator to kind of just distract her a little bit too. I actually really like this. One, it gives the patient something to do while they're being treated. And two, it's really good because bone will vibrate if they're using a vibrator as well. So it just is another insurance that I am down on bone. And now, I'm just continuing with the cheek. Of course, when you sit the patient up, you have them animate, you lay them back down. There's different areas of the face that you're going to see kind of where you want to inject a little bit more. So this is kind of a habit that I do. I'm assessing her smiling and I'm seeing different areas of her face. So I did want to inject again a little bit above her cheek. Now I'm doing a baby amount in her chin. Her rickets line was beautiful, so she didn't need a whole lot. But I kind of felt that when I sharpened up her cheeks just ever so slightly and sharpened up her jawline that I wanted to do just a baby amount in the chin. So that's why I did opt for that. And you can see it's ever so slight. I'm not doing anything crazy. We always talk about at the AAFE the injection perfection protocol that we call it. And that is essentially ensuring that you have checked off all of your safety measures. So prior to injecting, there's a lot of things that we do. First and foremost being knowing your anatomy, being down on bone, not giving more than 0.1 in a certain location. We also like to make sure that we are doing a good solid aspiration. We pull back that filler all the way back to the 0.1. And we just make sure that there's no blood in the hub, and we make sure we're not moving, we're staying on bone, we know our depth. Or if you're a little bit more superficial, you are keeping that needle moving. So you can see I'm doing the same thing on the other side. Now again, I did switch needles. I know it's not a new syringe, but I did switch needles to try to make her more comfortable here. So that is why I did opt to go to the piriform fossa first. And you know, if I were to have a complication, I'd love to know about it prior to continuing on with the rest of her face. So I do like to kind of do that first. Moving back onto the cheek. So now at this point, I have done both piriforms, a little bit in the chin, the left cheek, the left jawline, and now I'm going to move on to the right cheek and the right jawline. Now we teach cheek filler in level 2. We teach piriform, chin, and jawline in level 3 just because they are more advanced and higher risk areas. So do keep that in mind when you're trying to learn these advanced skill sets, that it will come with time, it will take time and experience, and you'll get better with time as well. Something else I wanted to note is that I do like oftentimes going in at a 90-degree angle just because it allows the patient to, 1, safety, and 2, it really is just a beautiful way to kind of, not so much lift, I know we don't like that word with filler, but it allows you to just kind of give the most kind of contoured, elevated cheek that you can. So oftentimes I do say go in at a 90-degree angle. It's easier to stay on bone. It's easier to kind of achieve the look that you're trying to go for. So here I am just kind of working my way around. I'm just about to finish off that syringe of filler, and then I'll be done with her cheek, I'm sure, too, as well, just knowing myself and treating this patient that I will go back and probably add a baby amount to the cheek as well. So just going back with a little bit of cheek filler here and just being careful with it. Even though you might want to put a little bit more than 0.1, I always urged you to stay safe with your injections. Always remember that and keep the injection perfection protocol in the back of your head. It will allow you to truly try to avoid complications at all costs. So you can see with this patient too, she does have a stunning jawline already, which is amazing. So I'm really just trying to snatch it up a little bit more, make it sharper. She's young, that's in style. That's always what we kind of want for my young patients, and that was what her goal was. So I'm just trying to do that for her and make her jawline a little bit sharper. And this is how I'm doing that. So you can see I don't have a ton left in that syringe, but I'm working on just trying to sharpen it up, make it match the rest of her face. The last thing you want is to have these really sharp or big cheeks and not have a chin or a jawline to compensate for that, or else it's going to look very off balanced. And the big word that we love in aesthetics as of late is balance, right? Everybody wants to come in for a balanced look. They want natural looks. So the last thing you want to do is kind of make their face very off balanced by doing that. And some clients, you know, they truly do need 2 to 3 syringes in the cheeks alone. So making sure that you have a patient that, you know, is aware that it's going to take 2 to 3 syringes, and being mindful of that is very important. So you can see she looks incredible. Very happy with her results at this point, and now I'm just kind of going back and reassessing her face overall and seeing where I want to go. So whenever I have that 0.1 left, I'm kind of just re-looking. I'm like, where do I notice I still need to go? What's going to look good? Pulling, poking, prodding at the tissue to just kind of reevaluate. And here I am deciding to put my last little bit of 0.1 on the lateral zygoma here. And then I will show the patient, I'll put some arnica on the patient, and I will send them on their way. And if you need to see them back for a follow-up, that is always an option as well. So like I said, this is a combination of level 2 and level 3 treatments as well as ultrasound. So keep that in mind. But she looks great. She just looks refreshed, relaxed. You would not know that she had anything done. You can see she's being silly and laughing, but she is perfectly fine and sending her on her way.